It can make you anxious. It can make you irritable. You can have trouble sleeping. You can even have palpitations. That's right, heart palpitations. Your heart may not beat properly. There are so many potential symptoms of hyperthyroidism. We are talking about those today. But by the way, you might have heard of Graves' disease. And if you've been wondering what Graves' disease is, Graves' disease is the most common cause of hyperthyroidism or overactive thyroid here in the United States. It's an autoimmune disease that really sort of attacks the thyroid, causing there to be too much thyroid hormone in your body. There are other causes of hyperthyroidism as well, but Graves' disease is one of them. But guys, this is something that you should know about. I'm Dr. Jen Caudle, by the way, practicing family physician, on-air health expert, and video creator. Let's talk some more. Okay, so I mentioned hyperthyroidism or an overactive thyroid, as I mentioned in the beginning, can cause anxiety, irritability, restlessness, etc. And you may be wondering, like, what's the deal? I've got more symptoms for you, by the way, though. And the reason why is because the thyroid gland, by the way, that sits right about here. It's like a butterfly-shaped gland that sits sort of at the base of the neck. And the thing about it is it's kind of like the engine of the body. The thyroid does so much. So when your thyroid is not operating properly, and I've done videos on what can happen if you have an underactive thyroid, because you can have symptoms there too. When you have an overactive thyroid, it can totally, for lack of a better word or phrase, jack things up, okay? It can cause you to feel anxious, irritable. It can also cause some people to have a tremor, sometimes in their hands, feeling tremulous. Also, it can cause fatigue, okay? Although some people feel revved up and like, and some people don't sleep enough with hyperthyroidism. I mentioned the heart rate, or heartbeat rather, because there are many people with an overactive thyroid that actually have palpitations or feeling that their heart's beating fast or irregularly, which could lead to problems down the line if that in fact is the case, and it's due to the thyroid and not treated. So it's important. Also, frequent bowel movements. Yeah, interestingly enough, you can actually have sort of frequent bowel movements with hyperthyroidism. Weight loss can happen. You can feel, despite eating, like eating either normal amounts or more than normal amounts, you can still lose weight or still feel hungry, like feel like you're just not getting enough in. Mood swings, I've talked about that. I've mentioned that many times because that's often a presenting symptom. You know, when patients come to me with anxiety or they come to me feeling kind of like, one of the things I'm doing as a family doctor is checking their thyroid, among other things. So that nervousness, irritability, change in mood swings, anxiety. Also, sometimes people get what we call a goiter. That's when the thyroid gets enlarged. You can kind of see a swelling at the neck. That's always something you should get checked out, by the way. Look, honestly, if you see anything on your body that doesn't look right, you should get it checked out. So let's just be very clear. Also, muscle weakness can be a symptom. There are plenty of other symptoms that can happen with hyperthyroidism, and not everybody with an overactive thyroid will have all these symptoms. It's even possible to be what we call asymptomatic, which means you don't really have any of them. So you say, well, how would I know if my symptoms are due to my thyroid or due to hyperthyroidism? Well, we're in luck because there is a blood test to check the thyroid, which is great. Your doctor would use that information along with the physical exam. We're going to be listening to your heart, your lungs, feeling your thyroid, all that good stuff. We're also going to be taking a medical history that's going to be talking to you about how you're feeling and what's going on and your history. There's plenty more to talk about with this topic of hyperthyroidism, but this at least is a start to get you guys going with the importance of the thyroid. Check out some of my videos on hypothyroidism. That's an underactive thyroid, because that can cause symptoms too that are equally as problematic, but just often different, okay? Remember, go to your doctor with any questions or concerns. Make sure that you listen to your body, you pay attention to your body, and ask your doctor about any of these things that I'm talking about so you can get your questions answered. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos on all sorts of stuff, COVID, medical conditions, thyroid, you name it, celebrity health. If you like this kind of stuff, make sure you subscribe to my channel and click the little bell for updates. Guys, it's great to see you. I'll see you soon.